I'm joined by Christine Tillig, who is a psychologist here at Eastbourne House, focusing in the area of PTSD. Are you able to tell us some of the common signs of PTSD?
Sure. So, initially, to sort of develop PTSD, obviously, you're going to have a traumatic event or a life threatening event, which you can either experience directly yourself or you can witness someone else experiencing that event. So, after that event has happened, there's sort of three, types or groups of symptoms that you may experience if you develop PTSD. So, one's hyperarousal. So, trauma is held in your body. And so, some of those symptoms can be a startle response, being quite hyper alert, having some sleep difficulties, muscle tension, things like that. Another one is avoiding anything that reminds you of the traumatic event or what you've witnessed. Avoiding situations as well. So it's that fight-flight response. And the other one is re-experiencing the event. So intrusive symptoms, which probably is more common knowledge as everyone thinks of PTSD, and flashbacks and nightmares and dreams. So re-experiencing things in your dreams.
And what are some of the maybe less common signs of PTSD?
So probably one of the important aspects of PTSD that can help from a perspective of a therapist, trauma therapist or psychologist, is that sleep issues tend to cover quite a significant amount of the symptoms of PTSD. So sleep issues can sometimes be a precursor to developing PTSD and insomnia as well, but it can also be one of the symptoms of PTSD. So one of the areas that's a really good starting point for assessment as well as intervention, once you've decided, you might do a screener or a questionnaire, and once you've diagnosed someone with PTSD, you may well want to look into their sleep hygiene, sleep behaviours, any experiences of insomnia. And so that can actually help to relieve some of the other symptoms if that's your sort of main symptom to treat initially.
And so when treating PTSD, what does the evidence base suggest are the most effective treatments?
So you have got your trauma-based CBT, which is quite broad. So within that is prolonged exposure therapy. So in Australia, that's golden standard. But if you look at sort of broader than Australia across the world, World Health Organization would say EMDR is also gold standard for treatment of trauma. So prolonged exposure and EMDR are great, but you can have adjunct therapies that are great to work with the body. So trauma-based yoga can be really good to release tension in muscles, which is a significant part of PTSD as well.
Thanks, Christine. Really appreciate you joining us.